Hello, everyone. My name is Essence Briscoe. I am the marketing director here at the Rutherford County Chamber of Commerce. On the Rutherford Works team, which is our workforce development team. We are here with Carter from St. Thomas Rutherford Ascension. He is going to be talking to you all about jobs that are available at St. Thomas Rutherford and possibly other locations, and about the culture, benefits, and how you can apply for those positions. If you have any questions during today's webinar, just place them in the chat box and I will read those to Carter during the presentation. And just please let us know if you need anything. Thank you. And I'm going to turn it over to Carter.
All right. Well, let me go back. Sorry. How's everybody doing today? I appreciate you joining. Again, like Essence said, my name is Carter Tunget. I am the recruiting manager with St. Thomas, really Ascension. St. Thomas is a ministry hospital of Ascension. And so we'll go over a little bit about that, but I wanted to kind of present not just on like jobs that we're hiring for today, but also just in general, like who is Ascension, who's St. Thomas, and what do we represent? Because I think more and more I think about when you try to join an organization, are you joining because it's of the job, or are you joining because of the company and the culture and things like that? So so I've got a little presentation. It really just kind of goes into Ascension, our culture, and then just briefly at the end, we'll talk about current opportunities that we have available. So I'll move along here. So so what is a company culture? And really it's shaped intentionally, and if everything about Ascension and our mission and our culture is shaped very intentionally. So we are a faith-based healthcare organization, and so we do not shy away from that. Many of our meetings start with prayer or some type of reflection, something like that. So we are actually one of the largest health or faith-based health organizations in the world. I think actually the largest in the United States. But so anyways, we operate, in 22 states. You think from a market capitalization, if we were a privately held organization, we're in the $20 to $25 billion a year annual revenue per se. So anyways, so it's a little bit about just, I guess, from an Ascension, but you think about company culture, it's very intentional. Ascension's actually pretty new. St. Thomas, if you've lived in the area for long, I was born and raised in Nashville area, and I was actually born at Baptist Hospital, which is now our St. Thomas Midtown Hospital. And sorry, I'm looking at my screen, which I'm looking at you all. I should probably move this, so looks like you guys are seeing the side of my head. Sorry about that. But anyways, but what used to be Baptist Hospital is now our St. Thomas Midtown Hospital, and St. Thomas has just been a synonymous name for in the Nashville area for years and years. It actually was started by nuns back in the 1800s, and so in fact, many of our hospitals and the way they got started, it was the daughters of charity that these nuns that basically just they cared for sick people, and then they built these hospitals, and so it's amazing. But anyways, that's like I said, our culture is very intentional. So I'm gonna move on. So so how do you identify company culture? I need to check out their website, kind of the About Me page, learning a little about mission, vision, all those things, and values. And if you go on our website, you can look at all those things. Go online and review, like Glassdoor, for instance. Indeed also has some areas where you can review, and just kind of learn for yourself. Now I always caution people when they're looking at reviews. Generally the people that have the time to do reviews are generally have had some type of something, a bad experience, and that's not that's never going, you're never going to get away from that in a company. But we do take our mission, vision, values very very seriously, and we spend a lot of time, effort, and resources into what we kind of talk about is easy entry into our organization, but hard to leave. And the hard to leave is because you want to, and we've done everything we can to engage with you as an associate, and maybe in your career pathing, school, education, any of those things. So check out our social media profiles. Got a lot out there. Shares a lot about what locally we're doing here. and really the growth and how we're serving our community. Ask around, and then when you're interviewing, ask the right interview questions. So anyways, we take it seriously. Move on here. So benefits of a company culture. I mean, I think all of these, I'll let you look over that. I'm not going to go over all of these, but one of the things I learned early in my career was somebody asked me, and we about fulfillment in your job and fulfillment in your career. And it's one of those things that at the time when I was younger, I didn't really understand that. But as I've gotten older, you really understand, like when I get off of work or when I'm had a rough week, I can always point back to what I'm doing and why I'm doing it, and it kind of centers you. And so to me, when I think about company culture, and the place that I want to work, am I working for the right organization, and am I working for an organization that I truly feel good about when I put my head down at the night, and appreciate the work and care that we're providing. So anyways, you guys can see that. I'm going to move along. And let me know, Essence, if there's any questions in the chat, if I need to stop or anything like that. So, okay. And feel free to ask questions, chime in or anything like that. So, and we talk about living the mission. These are our values. And again, these are all based on our faith-based our faith-based culture, really. And so service to the poor, generosity of spirit, and really what we always talk about is especially those persons in most need. And we'll talk a little bit about that in another slide, but just in general, how generous Ascension is in regards to caring for those that are most in need. Reverence and respect for compassion for dignity of diversity of life. And I can tell you too, one of the things that we do in regards to our values is that on our one-on-one check-ins with associates, I'm a manager, so when I check in with my associates, and I know that similarly with our other leaders, and they check in with their associates, we talk about our values and how are we living those, and how are we individually representing the mission through these values. So again, just when I keep reiterating that our culture is extremely important to us, and we put a lot of emphasis and effort into maintaining that. So integrity, I think that goes for I think that speaks for itself, right? So wisdom. One of those areas that I think that we're always seeking wisdom, and appreciate having people around me in this company that are also similar, but also seek wisdom and guidance in a very open format. So creativity, and then dedication. So affirming the hope and joy of our ministry. So move on. So here's our logo, and kind of go into what this means. So I'm not sure if anybody recognizes what the actual symbol means, but it is a Christian Trinity symbol, with green representing growth, blue for health, and purple for compassion. So, and then obviously the integration of Ascension with the Trinity symbol, and Ascension is also a Christian symbol as well. So essential behaviors, and we talk about these a lot, and I'll tell you that when we look at hiring people, these are some of the attributes we are looking for, and associates joining our organization. So, we listen to understand. We invite different perspectives, reflect on the things that we do and say. Communicate transparently, proactively, offer own perspective, but doing that. And again, when you go back to reflecting on actions and words, I mean, it's one of those things where, it's good to proactively engage, but make sure we're doing it in a respectful way. Take personal ownership and serve faithfully, and then respond to the needs of our individuals. So I think the top of that is right. Care for those we serve, and those who serve beside us. So. Community impact, here I mentioned that earlier. So in FY 2019, Ascension provided $2 billion in care of persons living in poverty and other community benefits programs. So if you look at the top right corner, our medical missions, we do those all over the state, and we do those all over the country. So that's where we go right into the heart of underserved or maybe impoverished areas in the state, and we provide free care. And so those have been just truly amazing. And so I think when people think about mission work, I know I tend to think about going outside of the country, and that's it, but in reality, like our mission work is right here locally. And these are the people that we serve here locally, and so there's people in need here locally, and so I love working for an organization that you know, they spend a lot of time and effort in organizing these around Tennessee. So anyways, a little bit about that. So why choose Ascension? We think about a relationship and environment. It's you know, provides a community, culture of service. I think when you think about faith-based Christian faith-based health organization, I think you know, service is one of the first words that would come to mind for me. I mean, that's what Christ spoke of, and so that's one of the things that we also try to exhibit in our mission and culture in general. So we advocate. So teamwork, creativity, appreciation for diversity is another one. I will say too that although we do very openly talk about our faith and are open to you know, we'll do reflections and prayer and things like that, we are also open to diversity as well. So we do have people from other faiths that do work for us. And we're okay with that. So you do not have to be a Christian or a Catholic or any of those kind of things to work from us. So I just want to be very clear with that. But we do have an appreciation for diversity, an environment of quality, a place for reverence, and a theology and a workplace from a spirituality perspective. So you know, some of the most interesting I would say presentations I've been involved in my time at Ascension has to do with theology and just kind of in general, right and wrong in regards to how we operate, ethics really, and generally those are the type of conversations that would bore you, but the way that I think that we think through things that honestly I would not have really put much thought into, but and a lot of it has to do with how we engage partners within our community that might not be aligned with our mission, but overall that care of who we're helping with and aligning with is something that you know, furthers our mission. So anyway, something that we continue to think about and provide a lot of thought so around that. So anyways. So this is where our current locations, and again, these are just our hospital locations. We have clinics all around throughout Middle Tennessee. So you know, if you think about going for just a wellness checkup or finding a primary care physician, things like that, we have clinics literally all over, and especially in Murfreesboro. So, and in fact, we are also serving Rutherford County's. You know, the government employees. So now we're integrated with them as well. So, but anyways, these are just some of our main hospitals, and the main three hospitals are Rutherford Hospital there in Murfreesboro, and then our two major hospitals in downtown, which are West and Midtown. So. And then just a boring slide at the end. Talk about current openings. Really, these are our kind of like, you know, if you have a degree or a tech degree or something like that, I would imagine you already are looking for jobs on our website with those specific qualifications or certifications. But these are some of the positions that we have that you can immediately get into with very little you know, from a certification, things like that, you don't need much. Now, pharmacy tech, I've added that on there. We've actually started what we call pathways, and we like to talk about pathways a lot. And really, that's just a career growth perspective. And so what we're doing is we're taking patient care technicians that want to advance their career and growing them into pharmacy tech. So our patient care technicians are really they are the heart of our hospital. They're the ones that, you know, when you're, you know, if you've ever had a loved one in the hospital, the ones that are generally doing most of the work and caring for your loved ones, those are our patient care technicians. We're actually advancing that role this year, so it's pretty cool. We're actually adding things like phlebotomy and bladder scans, and training those patient care technicians in those kind of skill sets, and then advancing compensation for those as well. So, so anybody that's thought about like, hey, I want to get into healthcare and then I want to grow, and then, you know, those are skill sets that you're going to learn that you can, you know, I mean, honestly, you'll be a certified phlebotomist at the end of that. You would be able to, you know, take that skill set in a nursing school or other things like that as well. So anyways, our patient care techs, again, I think think those are just, I use the heart, but I would maybe use the backbone really of our hospitals. Our phlebotomists, those are currently a temporary position. We are phasing our phlebotomy positions out, but we still have a big need for those. And then a lot of our phlebotomists are transitioning over to our patient care technicians in our advanced roles. So I pointed those out. And then our pharmacy techs, like I mentioned before, those work really closely with our pharmacists, but also they work on the floor, and they basically are making sure that people are getting the right medication. They're taking inventory, things like that. And so that's in a role that we are actually in the process, like I said, of creating pathways of taking, patient care technicians that are excelling in their role and want more, and growing them into pharmacy techs. So anyways, another position I probably should have added on here, I was just thinking about it. It does take there is a certification, but it's a medical assistant. We are always looking for medical assistants in the Murfreesboro area and beyond too, if you're open to a little bit of a commute. But we do have a lot of medical assistant positions in our clinics there around Murfreesboro as well. So, all right, that's all I've got for today. Any questions or thoughts, or just like to answer any questions you have?
If anyone has any questions, please go ahead and place those in the chat box. I actually have one question.
Yes,
So
ma'am.
you mentioned the patient care technicians. They get to grow into possibly pharmacy techs, but are those part-time or full-time jobs? And then are there age requirements?
Yeah, no, great question. And I should have been a little bit more clear there. So those are part and full-time, and we've got night positions. Sometimes we have just weekend only positions. We find that the night positions, we have a lot of individuals that are joining nursing school or whatever, and then they really only have time to work nights. So, but we have day, night, part-time, and then also PRN. So generally for our PRN positions, which you would consider almost for any of these positions, in the little bit amount of time that you're able to come in, they ask for, a level of skill to be able to walk into a position like that, because they don't have that a long of a runway to train you per se. If that makes sense.
Okay, and then we have a question. Do you have availability for high school students? Maybe
So,
seniors
yeah.
or work-based learning?
So we don't, but we have engaged, and not so much in Murfreesboro, but some other counties, we have engaged in a certified nursing assistant kind of bridge program for those that know what they want to do after they get out of high school. And so, no, we don't. You have to be 18. So, I mean, if you turn 18 prior to graduating high school, then yes, of course. The hours would probably be difficult to do while you're in high school as well. But yes, we have an 18-year, you have to be 18 years old to work here. So we have 18 requirement for that. So.
Okay. I'm not seeing any questions come in right now, but I actually have another question. I guess for new associates, what does mentorship look like for them so they can kind of get onboarded and familiar with the culture that you mentioned?
Yeah, so we actually do a regional I have a regional onboarding center, and so what they'll do is, every 2 weeks we have a large class that basically just orients these new associates. Things have changed quite a bit in COVID. So what we used to do in these classes of like 80 plus in a big auditorium, and it was like 3 or 4 days long, and it was almost like you were graduating, right? It was just this cool experience. We've kind of been reduced to virtual learning, and then we have we do have separated breakout classrooms for our for basically our hands-on skills training, and those are, since they are done in Nashville, we have limited. I think it's still 10 per group. So it limits that from a mentorship perspective. But within within the units that you work on, you're going to be working with, I mean, if you're a patient care tech or whatever, you're going to be working with the unit leaders and supervisors and charge nurses of those units to help really provide a mentorship per se, opportunity. And again, those nurses, I mean, those nurses many of them have worked as patient care techs and phlebotomists, things like that, and have grown up through the ranks. So many of them are there as well, to kind of, mentor and help guide us.
And now that you've mentioned COVID, are you all seeing any trends in specific jobs that maybe high school students or college students should be considering?
So we did, depending, we started having, we started opening positions up called screeners. And basically, as you might have seen, and like if maybe if you had to go pick a child up at school or something like that, they check your temperature and and ask a question. Have you had any symptoms, things like that? So we do have some like patient or some screeners for people that come into our hospital. So that has changed, but other than that, really not much. Uh, and even the way we operate, of course, you got to wear masks and things like that. That's now, or as constantly you have to wear masks in the hospital. But when we think about safety and all those kind of things, our hospitals are completely safe. We have very little transmission rates, almost zero, really. From patient to caregiver. So, anyways, thought I'd throw that in there too. So.
No, I love it. Okay, well, I don't have any further questions, so I guess we can wrap it up. If you all want to share this information with anyone that you know who perhaps is looking for work, we have the positions that don't require as much background or education listed here, and then of course St. Thomas Ascension has positions that may require, college degree or certifications and credentials online at their website. What's that website again, Carter?
Yeah, so it's jobs.ascension.org. And I will put that, let me see if I can make a chat. Let me see if I can put this in here. I'll do everyone. Jobs.ascension.org.
Oh, and we have a question now.
All right.
For the PCT position, what type of shifts do they work? Are they 8 hours, 12 hours, or rotating?
Those are 12-hour shifts.
Thank you. Great question.
Yeah, and they're usually 7 a.m. to 7 p.m. and then 7 p.m. to 7 a.m.
Ah. All right. Well, I want to thank everyone for attending today. Again, please share this information if you know someone who is looking, and also check out the available positions at St. Thomas. Thank you for attending, everyone.
Yep. Thank you. I really appreciate it.